This is the Center for Georgia Cancer Specialists in Decatur, Georgia. The people who work here have been treating cancer patients for more than 10 years, and one of the medications they rely on is Abraxane for injectable suspension, paclitaxel protein-bound particles for injectable suspension, albumin-bound. Abraxane for injectable suspension is indicated for the treatment of breast cancer after failure of combination chemotherapy for metastatic disease or relapse within 6 months of adjuvant chemotherapy. Prior therapy should have included an anthracycline unless clinically contraindicated. This video provides a general overview of Abraxane, the advantages of its distinctive formulation, and the simple steps to follow when reconstituting Abraxane to ensure successful administration. We're calling this the 8-minute in-service because that's how long this presentation lasts. It's also the amount of time you need to properly reconstitute 1 vial of Abraxane. Keep your eye on the counter to see how short 8 minutes really is. First, let's look at what makes Abraxane different. Unlike other paclitaxel formulations, the paclitaxel in Abraxane is bound to albumin. As you know, albumin is a human protein that carries nutrients, vitamins, steroids, and other compounds that are not water-soluble throughout the body. Because paclitaxel is not soluble in water, binding it to albumin makes Abraxane available to the body's tissues without having to use solvents. Abraxane is the only solvent-free taxane which eliminates the need for pre-medication to avoid solvent-related hypersensitivity reactions, thereby saving time and simplifying administration. Better yet, by eliminating solvents, albumin-bound Abraxane allows delivery of a 49% higher dose of tumor-fighting medication. Abraxane is supplied as a white to yellow lyophilized cake for reconstitution. Each single-use vial contains 100 milligrams of paclitaxel and approximately 900 milligrams of human albumin. The recommended Abraxane dose is 260 milligrams per meter squared, administered intravenously over 30 minutes every 3 weeks. Each milliliter of reconstituted Abraxane will contain 5 milligrams of paclitaxel.
Can you step on the scale for me, please, Elaine?
Yes. To determine the correct dosage, you first need to know the patient's body surface area, or BSA. As you know, BSA is calculated from the relationship between a person's height and weight. For example, a patient 66 inches tall who weighs 130 pounds has a BSA of 1.66 meters squared. Next, determine the correct dose for the patient by multiplying her BSA by the recommended dose of Abraxane. Because the recommended dose of Abraxane is 260 milligrams per meter squared, you multiply 260 by 1.66 to get the correct dose. In this case, her dose would be 432 milligrams, or 4 1/3 vials. Lastly, to convert this dose into milliliters, divide the total dose in milligrams by 5 milligrams per milliliter. For this patient, you need 86.4 milliliters of Abraxane. Each Abraxane vial equals 100 milligrams, so the number of vials correlates with the dose in milligrams, not the dosage volume. Remember, because Abraxane is a solvent-free, albumin-bound formulation of paclitaxel, functional properties of Abraxane differ from other paclitaxel formulations. Do not substitute for or with other paclitaxel formulations. Be sure to verify the dosage and infusion rate before using. Kishan Patel is a certified pharmacy technician who has been working at Georgia Cancer Specialists for 7 years. Over the past 2 years, he has had much experience reconstituting and administering Abraxane. Kishan is going to demonstrate the proper way to reconstitute Abraxane. To reconstitute Abraxane into a suspension containing 5 milligrams per milliliter of paclitaxel, you will need an Abraxane single-use vial containing 100 milligrams of paclitaxel and 20 milliliters of normal saline for each vial you want to reconstitute. You'll also need a sterile syringe. You may also choose to use a chemotherapy transfer pin to prevent aerosolization. Both PVC and non-PVC infusion bags may be used with Abraxane. As with all cytotoxic drugs, it is very important to exercise caution when handling Abraxane. Gloves should be used. If Abraxane comes in contact with the skin, wash the skin immediately and thoroughly with soap and water. Mucous membranes should be washed thoroughly with water if they come in contact with Abraxane. The first step is to reconstitute each vial by slowly injecting 20 milliliters of normal saline down the inside wall of the vial. Do not rush the procedure. Take at least 1 minute to inject the saline. Also, do not inject the normal saline directly onto the lyophilized cake because it will cause foaming. A broken cake does not affect the quality or stability of the reconstituted Abraxane. Just be sure to slowly inject the saline solution down the inside wall of the vial over a 1-minute period. Once the injection is complete, let the vial sit for at least 5 minutes to ensure proper wetting of the lyophilized cake. Next, gently swirl or invert the vial for at least 2 minutes until complete dissolution occurs. Do not shake or agitate the vial as this will cause foaming. If foaming or clumping occurs, let the solution stand for at least 15 minutes until the foaming subsides. After Abraxane has been properly reconstituted, it is ready to be administered. First, check that the Abraxane solution is at the right consistency. The reconstituted Abraxane solution should be milky and homogeneous without visible particulates. If you see any particulates or settling, the vial should be gently swirled again to ensure complete resuspension prior to use. The reconstituted suspension should be discarded if precipitates are observed. Reconstituted Abraxane in the vial should be used immediately, but it may be refrigerated at 2 degrees to 8 degrees Celsius for a maximum of 8 hours if necessary. It should be stored in its original carton to protect it from light. Neither freezing nor refrigeration adversely affects the stability of Abraxane. Use negative pressure to withdraw Abraxane from the vial. When injecting air into the vial, keep the needle tip out of the solution. If you inject the air through the solution, it will cause foaming. Withdraw the exact dose you need and inject it into an empty, sterile IV bag. No further dilution is necessary. Reconstituted Abraxane in an infusion bag is stable at ambient temperatures and lighting conditions for up to 8 hours.
Good morning, Elaine. How are you?
I'm fine, thank you.
You ready to get started today?
Yes, I am.
All right.
The reconstituted Abraxane is administered over 30 minutes, unlike other paclitaxel formulations that can take up to 3 hours. The use of an inline filter is not recommended. Also, Abraxane is solvent-free, so there's no need to administer antihistamines or steroids beforehand for prevention of solvent-related hypersensitivity reactions, saving you even more time. Injection site reactions occur infrequently with Abraxane and were mild in the randomized clinical trial. Given the possibility of extravasation, it is advisable to closely monitor the infusion site for possible infiltration during drug administration. Over the course of the past 8 minutes, you've seen how simple it is to correctly reconstitute Abraxane. 1 minute to inject saline down the side of the vial, 5 minutes to let vial sit, and 2 minutes to gently swirl vial. Just follow these steps to ensure proper reconstitution and preparation of Abraxane. Remember that solvent-free Abraxane is a novel formulation of paclitaxel that offers patients and healthcare providers some unique advantages. Albumin-bound Abraxane is solvent-free, There's no need for pre-medication to avoid solvent-related reactions, and it has a short 30-minute infusion time. It's important to be aware of the boxed warning, important safety information, and warnings, precautions, and contraindications for Abraxane that follow in the remainder of this video. Warning: Abraxane for injectable suspension, paclitaxel protein-bound particles for injectable suspension should be administered under the supervision of a physician experienced in the use of cancer chemotherapeutic agents. Appropriate management of complications is possible only when adequate diagnostic and treatment facilities are readily available. Abraxane therapy should not be administered to patients with metastatic breast cancer who have baseline neutrophil counts of less than 1,500 cells per millimeter cubed. In order to monitor the occurrence of bone marrow suppression, primarily neutropenia, which may be severe and result in infection, it is recommended that frequent peripheral blood cell counts be performed on all patients receiving Abraxane. Note: an albumin form of paclitaxel may substantially affect a drug's functional properties relative to those of drug in solution. Do not substitute for or with other paclitaxel formulations.